Hadas, what do you think? Should we get started?
I don't know, maybe you can wait 1 minute. I don't know.
Okay.
Yeah, let's wait. We're starting to see attendees come in and maybe just wait another minute or so. And thank you and welcome to everyone that is joining us. We're happy you're here.
Okay, I think we will get started. So welcome, everyone. Thank you so much for joining us today for this webinar on opportunities for UV technologies in low resource settings. My name is Nathan Moore. I'm a PhD candidate at the University of Toronto. I'm one of the leaders of this task force that organized the event today, and I'll also be moderating the event. So we have an exciting set of talks today, starting with a look at the general state and future of global water access, and then a couple of country-specific examples of how UV is being used. And then we'll have an open discussion, bringing together all of the speakers, as well as you, the attendees, to discuss opportunities, challenges, barriers, and needs surrounding UV technologies and sustainable development. But before we get there and start with all of that, I'd like to invite Professor Hadas Maman, who's the chair of the task force that organized this event, to say a little bit more about the group behind this webinar, what we hope to accomplish today and beyond with this entire task force initiative. So Hadas, I'll turn it over to you.
Thank you, Nathan. So first, welcome to our first official meeting on the UV applications in low resource settings. So it's really wonderful to have you here. And this webinar is presented by our task force as part of the IUVA. The IUVA is an international nonprofit organization that is dedicated to scientific and technical advancement of UV technologies for public health and the environment. The IUVA has over 500 members in over 30 countries. And we focus on development of data and information on the safe, effective use of UV technologies to help inform technical advancement, regulatory initiatives, and public interest. So we developed this to communities to find ways to provide safe water. This is our dream and mission. As there are many people in the world that are actually struggling with the consequences of unsafe water. Our community comes from various places in the world, from different settings and different experiences. Our goal is to increase our community, and we want all of you to be part of the SDG 6, UV SDG 6 community. We believe that UV can actually be a solution to provide safe water, as it doesn't require chemicals. It actually is very efficient. It doesn't change the taste of the water. However, it's also efficient in viruses. But when we look at the reality, we actually saw that UV is not widely implemented, and especially in low resource settings. And we want to understand the gaps and the challenges and the opportunities where UV can be used and target these goals. And this is our task force. I'll start with Nathan. He's actually the chair of the IUVA SDG task force. And he's connected to this initiative because he was actually growing in Jamaica with intermittent electricity and water supply. And when he compares this to other settings, he's really interested in understanding how to provide healthy and safe water. And this is Paul. Paul is a postdoctorate at British Columbia, and his research is on application of UV LEDs in marginal communities. His motivation is actually poor sanitation and poor water disinfection systems in marginalized communities. This is Professor Carl Linden. This is a picture that was taken in Uganda for evaluating their professionalized maintenance approach for securing safe access to rural hand pumps to sustain water service deliveries. And this is Carly. Carly is actually a PhD student and a consultant. She spent the last 6 years in sub-Saharan Africa working on WASH projects with NGOs and governments, and she actually saw the transformational impact of access to clean water, not only on communities, but also on individuals. For example, a mother that can confidently deliver a child clean environment, or an adolescent girl that does not longer need to miss schools due to a period, or a child that can spend their school days learning instead of fetching water. So actually, access to clean water are essential in uplifting any community. And this is Dana Posty, a PhD student that is working on developing UV LED disinfection systems to target rural areas. And this is Professor Sarah Beck, and she's actually really passionate about UV LEDs to ensure sustainable management of water. She and her multinational group are working on developing small-scale water disinfection and wastewater reuse systems in Southeast Asia, East Africa, and rural Canada. And this is me. I'm the chair of the IUVA SDG group and also the co-vice president of Europe, Middle East, and Africa for the IUVA. And we're developing tools to monitor water using the modified JMP, which is the Joint Monitoring Program, that actually addressing the knowledge, attitude, and practices of water towards safe drinking water in rural areas in India and Tanzania. And we would like you to join our efforts and join our community. We would love to learn from you, from your values, from your experiences. So therefore, please join us and contact Gary Corin for everything that you need. I will now, we'll return back to Nathan.
Thank you so much, Hadas. Just echoing what Hadas said, please, we'd love for you to get involved in it and to hear your stories and your perspectives about all of this. So please reach out if you'd like to learn more or get involved. And also, please feel free to be as active as you'd like in the chat. Post your questions and your comments throughout today's webinar, because we will be having that open discussion at the end to, again, discuss everyone's perspectives. So our first talk today will actually be a discussion between two professionals who are actively engaged in many areas of water sanitation and hygiene access, from monitoring to policies and actual program delivery. So the first speaker, or the first of two speakers, is Carly Wong, who Hadas mentioned. She is an engineer and independent consultant who has worked with NGOs and governments designing and managing large-scale climate and WASH projects across a dozen countries in sub-Saharan Africa, as well as in the Canadian Arctic. She's pursuing her PhD at the University of Toronto, investigating UV for water treatment and security in low resource settings. And then the second speaker is Clarissa Brocklehurst, who has worked with and currently works with many international humanitarian and development agencies. She is currently an adjunct professor at the University of North Carolina, but I will actually leave Carly to say a little bit more about her. So Carly, over to you.
Thanks, Nathan, so much for that introduction. And thank you all for being here today. My name is Carly Wong, and as Nathan mentioned, I've also spent the last 5 years working on improving access to WASH in sub-Saharan Africa. Now, the reason for why I got into this field can really be attributed to a handful of people, and one of whom is Clarissa Brocklehurst. So it's a sincere pleasure to be introducing her and having an overview discussion with her today on global water challenges and innovation in developing countries. So Clarissa Brocklehurst is an adjunct professor in the Department of Environmental Sciences and Engineering of the Gillings School of Global Public Health of the University of North Carolina, and is an affiliated faculty member of the university's Water Institute. She's worn a variety of hats, many within the field of WASH, as the previous country representative for WaterAid in Bangladesh, a regional urban specialist for the World Bank's WASH program, the chief of UNICEF's WASH section, and an advisor to the Sanitation and Water for All Global Partnership. Now, Clarissa chairs the strategic advisory group of the WHO UNICEF Joint Monitoring Program that tracks global progress on water and sanitation, and she is a member of the supervisory board of IRC WASH. So Clarissa, thank you for bringing your wealth of expertise to kick off this IUVA seminar on the SDGs. For those of you who may be unfamiliar, in 2015, the SDGs, or Sustainable Development Goals, were adopted by the UN and member states as a call to action to address the critical global issues of people and the planet by 2030. So Clarissa, perhaps you can shed a little background on this. What is this agenda about, and what's our progress to date?
Okay, thanks, Carla, and hello to everybody, and thank you very much for inviting me here. I think the one thing that you forgot to mention, Carla, is that I'm a fellow Canadian, and despite the fact that I'm associated with the University of North Carolina, I am sitting among feet of snow in Ottawa right now. I'm going to share my screen and see if we can get the slides up, which I have to say that Carla very helpfully helped get ready for this. So I'll just go to the first one. So just to echo what Carla said about the Sustainable Development Goals, I'm sure that everybody on this call is familiar with them. I think the point to make about them is that they are extremely complex. When they were first put in place, there was a lot of criticism of their complexity. There's 17 goals, there's almost 200 targets, but you need a complex set of goals to address the complex set of problems that the world faces at the moment. So there are goals in here for things like climate change and gender equality. And as you're all no doubt aware, for the first time, there is a standalone goal for water and sanitation, very different from the Millennium Development Goals, in which water and sanitation was buried within one of the other goals. This is a call to action. It's a call to action to governments, and there is ongoing monitoring to tell governments how well they're doing in terms of reaching these goals. And what I'll do is I'll just talk a little bit about the type of monitoring that goes on. Carla, do you want me to get into this now, or do you want to formulate a question around this?
No, I mean, you can go ahead and get into it. I think the point is, yeah, these SDGs are also interconnected. So with SDGs all there, water contributes to, aspects of poverty, food security, health, education, economic growth. So I guess the next question is, there are almost 8 billion people in the world. So how do we measure this, and how much progress really has been made so far?
Yeah, good point. And I'll talk a little bit later on about the connections with gender in particular, because we have a tendency to think about water as being connected to health foremost and perhaps the environment, but there's a huge gender equality component to water and sanitation, which we also have to monitor. So I think several people have mentioned the Joint Monitoring Program. The Joint Monitoring Program has monitored progress in water and sanitation for 25 years now. It predates the Sustainable Development Goals, but it is now pivoted to monitoring those goals. It's run by WHO and UNICEF. And it has created a ladder, and during the Millennium Development Goal period, the MDG period, there was a ladder that looked very much like this, but the new ambition of the Sustainable Development Goals means that the rungs in the ladder have been slightly changed. And one big change is that there's a whole new ladder, a whole new rung at the top, which is safely managed. And this is drinking water from an improved source that's on premises. This is a big shift, and completely free from fecal contamination and chemical contamination. And then the rung below is drinking water from an improved source that isn't on premises, but is not more than 30 minutes away round trip for collection. And as I said, this has a huge impact on gender equality, because as we know, these long trips for water that so many of us have witnessed working overseas are almost always done by women and girls. So this latter reflects the need to measure things like accessibility of services and whether they're on site. So if we look at the data, there's still 2 billion people in the world who still lack access to the top rung of that ladder, safely managed drinking water. And of those, 1.2 billion are using basic services, 282 million are using limited services. There's a huge number of people using unimproved. And then there's a surprisingly high number of people using completely untreated surface water. So we still got a long way to go towards achieving the SDGs. And if we look at the people who are still lacking even basic drinking water, you can see that there's huge regional differences. So these are ladders that they show the trend from 2015 to 2020. And they show on a regional basis what regions are managing to achieve. So you can see that big dark blue bar, that's Europe and North America, almost 100% achievement of safely managed. And then you can see at the other end of the spectrum, down at the left, you can see sub-Saharan Africa, where only 30% of the population has safely managed. And you've still got a very large number of people who are using either basic or unimproved or even surface water. So still a long way to go. And I'll just show this slide as well, which is looking particularly at the percentage of households who have water accessible on their premises. And again, you can see here that sub-Saharan Africa is an outlier there, with only 13% of households being able to access water that is within the household. So that means everybody else is walking to collect water and carrying it home and storing it in the home. And of course, quite apart from the burden of drudgery this places on people, mostly women and girls, it also creates lots of opportunities for that water to be contaminated. So even if water is of good quality at the source, never guaranteed, but even if it is, by the time it's being carried home, stored in the home, and then retrieved from the storage container, lots of opportunities for it to have become contaminated. And a while ago, the Joint Monitoring Program started incorporating water testing into household surveys. And so we begin to have a picture of whether even improved sources, it's a technological definition. So this was used for years as a proxy for water quality. The theory was that if people were using water from a protected source of some sort, like a well with a hand pump, then that meant that it had to be clean. But of course, we all know that there's no guarantee of that. And sure enough, when the JMP started to do widespread testing, it turned out that many of the sources that were considered improved, in fact, very few of them showed that no E. coli was detected. So you see a big difference between being improved and being free of E. coli on this slide. And then this is the last slide that I'll show, if I can get to the last slide, which is that the JMP has managed to do household level water quality testing in about just over 30 countries so far, I think almost 40. And as you can expect, you see that many of those countries are showing very high levels of contamination. And I think it's important to point out here that this is water tested within the household. This is not testing source water. This is testing the water that people are actually consuming in the household. And as you can see, orange in this chart is very high levels of contamination. And particularly in poor countries, you're seeing extraordinarily high levels of contamination. So still a long way to go and a lot of challenges to overcome.
So in fact, we've actually seen quite, significant progress with achieving better, improved access to drinking water, but clearly we have certain areas in the world that are lagging behind. And obviously now with this data coming in, many are still drinking contaminated water. So Clarissa, what are some of these roadblocks thematic roadblocks in improving access to safely managed and, water free from contamination?
So I think, many people on this webinar are probably have technical backgrounds, and I'm an engineer myself. We'd all like to think that maybe the solution is one, better technology, and certainly that's part of it. But, the experience is that in most cases, the real roadblocks are institutional and managerial. That it is very, very difficult to bring about the enormous sort of quantum shift of change towards clean, accessible water available in the home if you don't have the institutions in place. And many of the poorer countries where we're seeing these low levels of achievement, they lack the institutions, they lack the policy, they lack the regulation and regulatory regime that would make it possible to put in sustainable services. There's a lot of aid activity in the water and sanitation sector, but the amounts of money that are being spent are relatively small compared to the needs. And in many cases in the past, international aid has merely set up parallel systems and left government unable to actually play the lead role that it needs to play. So I'm afraid technology doesn't tend to be a silver bullet. Of course, good technology is always needed, but we need better institutions, stronger systems, better regulatory regimes. And in particular, in the absence of good policy and predictable regulatory regimes, private sector entrepreneurs are very reluctant to enter this sector. It's potentially a risky market. In many cases, governments have felt that their overwhelming mandate is to keep prices of water low. And of course, very low prices for water, very low tariffs means that the water sector then becomes a money-losing operation. And it doesn't have to be that. Water systems don't need to constantly lose money. And with good regulation, there is room there for innovation and for higher service levels.
Okay, so I mean, for our audience at the IUVA, we're looking at innovative approaches through UV to address some of the world's water challenges. But we've also seen many different innovations in the developing world. And you've mentioned the lack of this enabling environment for, investment into water. So many, some innovations succeed, but many fail. In your opinion, what is the value of innovation and new technology solutions to ensure global access to clean water by 2030? Like, is there room for more innovations?
I think there's always room for more innovation. And I think it's interesting to look across the water, sanitation, and hygiene sector as a whole. I work across all three subsectors. And certainly in sanitation, we're seeing a great deal of innovation in a sector that was seen for years as, certainly not being a very sexy subject. Sanitation, unfortunately, is always seen as sort of less interesting as water. But in terms of innovation, it's incredible. And entrepreneurs and scientists are coming up with new solutions all the time. And the question is, how do you create the policy that opens the door to those? How do you particularly, how do you convince governments to be able to take risks, but carefully thought out risks, and to take the lead in such a way that these innovations are allowed to be tried out, tested, monitored, evaluated, and then, as I say, the door is opened to those that will work. And I think that for development agencies, support agencies like UN agencies, UNICEF, who I often do work for, the World Bank, development banks like that, some of the bilateral agencies, they really need to be looking at ways that their aid fosters this kind of innovation, but fosters this kind of innovation-friendly policy making. And governments have often been rather reluctant to take the lead in this.
Okay, thanks for that. So we have a few more minutes left in our chat, but I figured I could ask you, a final question as a takeaway. What could we, academics, industries, researchers, the IUVA, us sitting at home from our work at-home offices do better to contribute to these ambitious goals? Is it better research and collaboration? Is it advocacy, building educational tools? Like, what are some of the things that possibly we could get involved in or do from where we are?
I think one of the things that the water and sanitation sector suffers from is these terrible silos. Maybe other sectors suffer from this as well, but I think water and sanitation has definitely suffered from it. And so people work very much in their area of expertise, whether it be water versus sanitation, or even within the water sector, whether it's, you have a whole bunch of people who are obsessed with hand pump design. And then you have another whole bunch of people who are obsessed with ultraviolet treatment or whatever. And we really need to break out of these silos and collaborate with each other. It doesn't mean that everybody has to be an expert in everything, but we have to understand what other people are doing. And I think also crossing this technology policy divide. I've seen very much in what I've done so far is that they're seen as sort of two different animals. There's people who advise governments on policy, and there's people who work at the coalface working on technology. And we really have to understand each other. We also need a lot more collaboration between agencies working in the field. This tends to be a very territorial sector, and we just really need to get away from that. Otherwise, there's a feeling that everybody either has to do everything, or you only do the one very particular thing that you work on. So I'd like to think that a new spirit of collaboration is opening up. Maybe the Sustainable Development Goals also help contribute to that, but it's something that we really have to work on. We have to understand what other people in the sector are doing, why they're doing it, and how our own actions can contribute to the success of what other people are doing, and vice versa.
Yeah, I think for me as well, someone who's, a hard engineer and technical background, coming into the field was a really hard slap in the face. You'd mentioned it earlier, talking about women and girls and how that sort of subsection really suffers the most when it comes to the burden of water. And for me, like, really, you can come in with innovations, but ensuring you have that technology that's well designed and inclusive and actually comes from a local context is really important. And I think so that's where collaboration is really important there. Is there anything you wanted to add on that women and girls aspect? Because I think it's so crucial.
Yes, I think it's so crucial. And of course, when it comes to gender equality, we've got lots of colleagues who work on other aspects of gender equality. And we have to be able to make the case that water and sanitation is a big component of advocacy on gender equality in general. I think the other thing that happens is that we're often forced into this mold where you have to justify investments in water and sanitation on the health benefits. And if any of the people on this call are familiar with any of the research work that's being done on quantifying the health benefits of water and sanitation, it's extremely difficult to do. Just because you give somebody a water filter or help them build a latrine does not mean that you're going to be able to cut out diarrhea in their family. There might be all kinds of other ways in which they're becoming exposed to health risks. That doesn't mean you shouldn't help them have a water filter and help them have a latrine, because there are other well-being benefits. And you could argue that you could justify a lot of what happens in the water and sanitation sector on the gender equality benefits alone. So I really would fight against this pressure that we always have to try to justify what we do on health benefits alone. Water and sanitation make a huge difference to people's lives in ways that have nothing to do with health.
Great. That's really excellent. So I'm going to wrap us up because we have plenty of other great speakers left. Clarissa, are there any final notes you wanted to say before we move to the next speaker?
No, I'll be very interested to hear the questions and hopefully be able to respond to them. So looking forward to the other presentations.
Great. Thanks for chatting with you. And if anyone has any questions at all, please feel free to put them in the chat and we'll have a discussion later. On to you, Nathan.
Oh, thank you. Thank you so much, Carla and Clarissa. I'm sure many of those themes will come back in our open discussion later on. One thing I just wanted to mention is that this webinar is being recorded. A copy of the recording will be available a couple of days after the event. So everyone in attendance, you'll be able to look back at the information being shared today. So from here, we're switching over to case studies of how UV disinfection is being used. And first, we are going to be hearing from Dr. Fermín Reygadas. Fermín has a PhD from the Energy and Resources Group at the University of California, Berkeley. He's co-founder and CEO of Cántaro Azul, the largest water, hygiene, and sanitation organization in Mexico. Since 2006, Fermín has led the design, implementation, and evaluation of technologies, service delivery models, financing mechanisms, advocacy strategies, and public policies that contribute to expand the human right to water and sanitation. He is an Ashoka Fellow, and his work has been recognized by the US Environmental Protection Agency, the Big Ideas Competition at Berkeley, the 6th and 8th World Water Forums, and the UBS Visionaries Social Entrepreneurship Award. So I'll pass it over to you, Fermín.
Thank you very much, Nathan. I'm really happy and delighted to be able to share our experience with UV water disinfection in rural communities in Mexico. And today I will be first sharing the work that we have done, both combining research and practice on the design, implementation, and evaluation of a household UV water disinfection system that we call the Mesita Azul, or the little blue table. And then I will spend a little bit of time, go faster on those two other aspects on UV disinfection at the community level or a kiosk, and also in safe water in schools. So first on household water treatment and safe storage, we started doing our work when we were a team of students at the University of California in Berkeley. And we were doing research on water availability and water quality in rural Baja California. This is in the north west of Mexico. It's a very arid region with scattered communities, very small communities. And in most of these communities, they were small and so scattered that pipe water systems didn't make much sense and had not been implemented in the region. Just to give you an idea, here in the pictures you can see the type of sources. They tend to be wells, shallow wells, where people would access what looks like clean water. However, water was contaminated from nearby latrines and also cattle that deposited feces and also pathogens on the water. Then water was transported to the house, by carrying the water in buckets, by improvised hoses, or sometimes even by trucking the water to the home. And at the household level, water was stored in these traditional containers that are called tinajas. They're most of the times made out of clay, and they keep the water cool, and the water is accessed through a cup. One of the big challenges, as Clarissa was saying, is that the water, even in these cases, the sources were not necessarily safe to drink. The water got more contaminated as it got closer to where people drink the water, both through the transportation mechanisms, but also as it's stored in the home, and particularly when it's extracted with these cups, and in cases where the hygiene is not necessarily there are not many mechanisms to practice a good hygiene. There was only a few percentage of households that used household chlorination or boiling in a daily basis, no more than 5% of the households. Most households had done it at one point, but this was not a habit that was being practiced in a daily basis. And most other household water treatment technologies had not been promoted in the region, so people did not really have an idea about them. And what we started learning in this research is that particularly chlorination and boiling, these are household water treatment mechanisms that are really cheap. They can be practiced by a household, but they also come with very big barriers for everyday use. In the case of boiling, it's waiting for the water to cool down, collecting wood to boil the water, and it just ends up being a hassle that people do not do on a daily basis. And in the case of chlorination, I have to say that in Mexico, there haven't been any products that are designed specifically for household water treatment. So the government just promotes using bleach for disinfecting water at the home, and people just don't like the taste. There is a very big barrier for for using chlorine bleach at the household level. So we started a process first as a group of students, but then together with Cántaro Azul, a nonprofit that we co-founded and developed to really be able to bring what we were designing in academia, to really bring it into practice. And we went through a process of designing a UV disinfection system that we thought could make a lot of sense in this type of communities. One of the challenges of UV disinfection is that it requires electricity, but in most Latin America, particularly in Mexico, there is much broader coverage of electricity than, say, water services. So that wasn't really a challenge. And in this region, most households had solar panels that could use UV disinfection, where we could plug in the UV disinfection. So you can see here how the product started to develop into something that could be more replicated in an easier way, and also that would be more that would tackle some of the challenges that people were seeing. So the key thing here is that we went through an iterative process, first starting at the lab and designing the UV chamber, and then spending more time with a small group of households to learn what could work for them, try it in 24 households, gain insights from that, run another design, test it in 200 households, and then finally came with the final design that we call the Mesita Azul, which stands for Little Blue Table in Spanish. In terms of the disinfection aspect, one of the key elements here is that in comparison to most commercial UV disinfection systems, here the lamp is raised above the water. And the objective of that was to reduce maintenance from the user's perspective. With most commercial UV systems, the lamp is situated in the center of the UV chamber to provide more efficiency, but it depends on the water quality. It can provide scale. It can create scaling on the lamp or the quartz leaf, and that requires periodical cleaning, which we didn't think was feasible for households to do that. So we ended up taking on some early designs of UV disinfection more than 100 years ago, where the lamps were above the water, and that allowed us to have a system that basically doesn't require maintenance until there's a lamp failure. This UV system particularly operates at a really fast flow rate, 5 liters per minute, which is a very big advantage in comparison to other household water treatment systems for this context. And easy to use, doesn't change the taste of water. And also the other element important here in terms of design was that we ended up creating a chamber that provided a dose that was almost 3 times higher than what the NSF ANSI standard require, with the idea that throughout the lifetime of the system, the lamp would still be providing a dose that was high. As its output it starts to diminish, it would provide a dose that is higher than what is recommended. And so we packaged the technology inside a program that started with a needs assessment carried out at the community level, a community presentation, the installation of the systems, training of local people from the community to carry out certain basic maintenance, not so much on the UV chamber, but on other aspects of the technology like the valves, and then doing a few follow-up visits. We did a randomized control trial with more than 400 households in 24 communities. And I wanted to share just quickly some of the results that we obtained. And here in this graph, you can see the level of E. coli that was found on samples across this study. And the color of red is high risk of contaminated water, and blue means that no E. coli was found. And you can see here that when we collected samples, people operating the system in the field from the outlet of the UV system, we basically found no contamination, but there was some contamination happening at the storage container, even if it was considered a safe storage container. And most of this recontamination happens because most of these households don't have concrete floors, and there are sometimes animals coming into the kitchen and to the household. But we also observed an increasing contamination happening at the vessel, at the glass or the cup. that people were filling from this storage container. So that's kind of a challenge that most technologies face, even chlorination. We observe that happening, and also doesn't spend enough time to be able to eliminate the pathogens that are on a glass of water. But that's one of the important challenges to pay attention into how contamination is happening. However, compared to households that we used as control, that were sometimes boiling and sometimes chlorinating, but most of the times not disinfecting the water, we saw a great improvement in reducing the contamination of water with the implementation of this technology. In this graph, I just wanted, it's a complex graph, but on the left side, in the column that says adoption, in the circle, it's the intervention group where the Mesitas Azules were promoted, and people, 90% of families acquired a Mesita Azul. So if we look at adoption, 90% of people adopted a UV system. In comparison to that, 40% of families had at one point tried some type of safe water access, like buying bottled water, boiling, or chlorinating. But when we move to the columns on the right, which is the level of access that people have at any given moment in unannounced visits, we see how the adoption drops down in the case of the UV systems from 90% to 60%. And in the case of the control group, it drops from 40% to 20%. And if we move one step further into looking at habits by understanding when the last glass of water, where they obtain that water, we see an even further drop. In the case of the UV system group, it goes from 90% adoption to 50% of having this habit of consuming safe water. And that's something that was very surprising to us, because we thought that the main challenge was, if we are able to increase access, we should be able to impact the habit of consuming safe water directly. But so we were really surprised by this result. And when we looked at how households manage water at the home, even if they had access to safe water through the Mesita Azul, they still store water in other containers that use for washing dishes, washing clothes, washing their hands, or just watering plants around the house. And it is really difficult to change the habits and ensure that everyone in the household just consumes exclusively safe water for drinking purposes. And kind of what we were observing here is that these technologies, household water treatment can really empower end users to have access to safe water, but it also transfers a lot of burdens. And this is similar to what Clarissa was saying, in terms of that the technologies are very important, but you need kind of an institutional support that is much broader to ensure that everyone is drinking safe water. And these burdens that are transferred to the households, like convincing everyone to only drink safe water, fixing the Mesita Azul or any other household water treatment system when it's broken, they negatively impact the sustained use of these household water treatment technologies, particularly for the families that have least resources. And we also observe that this narrow focus on household water treatment on drinking water just contributes to poor compliance as well, because you always have these other sources that have contaminated water. And so as part of this research, we came to a conclusion that there was really a new paradigm was needed, one that instead of focusing on the product, starts to focus more on service-based household water treatment programs. And here is where we, as an organization, we turn our focus into community-based water management, recognizing the local committees that are usually created by assemblies in indigenous communities or in rural communities, and working with them to strengthen their capacities. Some of the time, strengthening their capacities means bringing new technologies, more innovative technologies that are designed for the context, but it goes beyond that. And with community-based water management, we really think that we can move an important step forward into being able to create or foster sustainable water services. And one important element to share here is that in general, we believe that water programs are one of the most effective public health interventions. But kind of what our study showed was that if we focus only on the technology, that technology empowers people and communities that are doing better off already. And those households that are lagging behind in a community, that empowerment is not enough because it comes with additional responsibilities that really limit their potential. So we thought that if we do not include a service delivery model, what ends up happening is that this big gap that exists of inequality within the communities or within a region, it just continues, and the technologies only work for those that are doing better off already. So now moving from this aspect of developing a service delivery model, which we're happy to share in another context, we also have tried in the past years to develop innovations that tackle this challenge at the household level, that they have multiple water sources and only a few of them are clean with household water treatment. And so we developed this concept with the idea of having kind of a small system that disinfects the water, stores it in a safe container, and in this case is the container on the top of this system that has 250 liters, allows most families to have enough access to meet the human right to water and usually their daily water needs. But then it delivers the water to different points in the home through a local pipe system with different taps. And the key goal here is to bring the taps to the places where people are already using water. Sometimes it usually ends up being a place where people wash their clothes, which they usually wash their hands in there, the kitchen, of course, and also a place where the toilet or the latrine is to foster hand hygiene, and also sometimes where people take a bath. And the goal of this design is to reduce the need for storing and recontamination happening at the home. We're doing this study as part of a consortium called Safe Water, where multiple universities from Northern Ireland, Colombia, Brazil, and Mexico are participating, universities and nonprofit organizations. And in particular here in Mexico, we are testing in parallel two types of UV disinfection systems. One is a commercial system that has the lamp submerged in the water. It's on the left side of the picture. And on the right side of the picture is the UV chamber that we designed in Cántaro Azul together with UC Berkeley that has the lamp above the water. So we are kind of towards the end of the study, and we will be very interested in sharing our results, and particularly also comparing, if there's really a need for having the lamp raised above the water, if that reduces maintenance, but most importantly, if we can have a significant improvement in terms of water quality when all points of access in the home of the water is being disinfected. So now I will go much faster on these two other aspects of our experience. And as we started working on household disinfection, but also we saw the potential of, in certain communities that were a little bit bigger, but that did not have pipe water systems, to do filtration of water and UV disinfection at a centralized level, and then distribute water from there to the homes. And so, these are just a couple of pictures of examples of the work that we have done. And what we ended up understanding was, again, that if we did not turn this into a service delivery model, then only a few households will come to the kiosk and get water. And so we designed a social franchise model run by local women entrepreneurs. And we have implemented about 40 to 50 kiosks in South Mexico. But this more developed model with a social franchise, we have implemented 6 of them, and in general they have worked well. But we also see kind of this big struggle where we're tackling 3 key challenges of development, and one of them is access to safe water, the other one is women empowerment, and the other one is having kind of a circular economy in the community. And in a way, like those, packaging those 3 challenges has made it very difficult to be able to scale and replicate the model. And then finally, I want to briefly share our work with safe water in schools. So Mexico has more than 100,000 schools in the country, and most of the schools in rural communities do not have access to safe water. And so again, we started with first implementing the Mesita Azul in very small schools, and started to see kind of a big improvement in increasing access to safe water. And so we started moving from this design that we had developed for household systems and tried to develop a design that made more sense for schools. And a big part of that was to do 2 things. One is to see the technology as a great learning opportunity, and that required to make the technology more transparent and more understandable. And the other element was to, the schools are key spaces to develop healthy habits. And so we started creating a lot of materials which are freely downloadable and adaptable from our website, to really engage the students around activities on water, with the key objective of trying to develop the habit of consuming safe water at the school, and then trying to move that habit into the home, or at least bring awareness into the home of the importance of safe water. Another great opportunity of this program has been to put in contrast the consumption of highly sugary drinks, which are very common in countries like Mexico and are producing a very negative pandemic on obesity and diabetes, and try to contrast that with drinking safe water and all the health benefits around that. And so this, you can see again, these technologies are used as an element, the UV disinfection, but one of the key components is to be able to have different points in the school where you can access safe water. We have developed different models that fit the sizes of schools and their needs. In most cases, we use rainwater harvesting, and we have found that because of the size of the roofs of schools, schools across Mexico, whether they're in dry and arid regions or in wet and regions with a lot more precipitation, they can meet their daily drinking water needs from rainwater if you have adequate storage containers. And of course, in larger schools, we have been able to do activities that are more, even engage more the kids. One of the things that we have found is that in these rural schools, there's a lot of change across teachers and the staff of the schools. So these systems that we have implemented, about 150, they are being operated and maintained by kids in 5th and 6th grade. They're the ones who absorb most of the responsibilities of operating the systems, washing the storage containers, bringing them into the classrooms. And this has been going on for several years now. And so we have been able to understand that if there's enough training and certain follow-up, kids can absorb this type of responsibilities, and they can secure access to safe water in the schools. So, with this, I would like to, finish this part of my participation on the webinar, just kind of sharing broadly kind of the work that Cántaro Azul has done in terms of UV disinfection in different levels, from the household level to the school level and the community level. And in general, we see that UV disinfection, it's a very effective technology, and when it's coupled with a service delivery model, it can really bring a solution into communities to access safe water. Thank you very much.
Oh, great. Thank you so much, Fermín. Yeah, that was really interesting, and I'm looking forward to hearing more again in the open discussion. I just wanted to mention to everyone in attendance, please keep your questions coming in. The speakers and the moderators, everybody working behind the scenes on the webinar, doing our best to answer any specific questions for the speakers. And I mean, the discussion in the chat already has been great, so please keep that coming. Now we are going to be switching continents with our next speaker, specifically heading to East Africa. Our next speaker is John Lubango, who is a branch manager at Davis and Shirtliff Group, which is a leading company in water and energy solutions in East and Central Africa. He has an industrial engineering and management degree from the University of Dar es Salaam and is currently pursuing an MBA at the same university. He has many years of experience in designing, executing, and overseeing small or domestic to large scale or industrial community level water and energy projects across all regions of Tanzania. So thank you so much, John, for being here, and feel free to take it away.
Thank you. Thank you very much, Nathan. I'm very happy to take part in this webinar to share our experience from our perspective as a leading water company in East Africa. My presentation will be based more on Tanzania, where I'm currently based. So I will be sharing some case studies at the end of the webinar to show what we are doing in Tanzania. As introduced by Nathan, my name is Johnny Lubango, and I'm a branch manager. I've been working with Davis and Shirtliff for over 9 years now, working with various stakeholders who are working on water sector, NGOs, government, and private schools and government schools. Yeah, my presentation will be will cover 3 part areas. Introduction to DNS, just to give you an overview, who is DNS and what we do. And I will share our range of UV product that we have, and I will have some few case studies to share with you. Davis and Shirtliff is a water and energy company established in 1946 in Kenya. It's a leading supplier of high quality solutions with over 900 highly trained professional staff. We are ISO certified to demonstrate our focus on quality. The company in Kenya, headed in Kenya, is well resourced with a lot of resources in Kenya. Our main warehouse, our main storage is in Kenya, which distribute to the rest of the group. Our footprint, we are now covering the area of East Africa and Central, as you can see on that map. We are in more than 8 countries. Now we are looking to move to West Africa, and our target is in Ghana. The principal products that we focus are water pumps, borehole services, water treatment, swimming pools, solar generators, and also irrigation. Just to give you some overview on our scope on water treatment. Water treatment covers a wide range. We cover from potable to wastewater. We have quite a big range of domestic units for households, where cheaper and very effective, is simple to use, both UV and non-UV. We do have also do commercial units like the ALO and large treatment plants. depending on the requirement, and also we are in chemicals for various applications. On our UV lenses, this is the smallest UV that we have. This comes pre-assembled, as you can see on the photo, making it very easy to fit it and use it. It has a UV of 25 watt, which is quite very much easy to learn. It doesn't require a lot of power. This comes, as you can see on the light, you have the filters for pre-treatment to make sure that the water coming in are clear to allow the UV to perform better. That's a main challenge in most areas. Water are highly contaminated with a lot of suspended solids, and with UV, the water with suspended solids, they cannot be effectively treated. So we make sure that we have effective treatment before water going to the UV. This goes mostly to the households. This is another kind of product that are pre-assembled locally to make it easier for a user to plug in and use it. As you can see, it comes with only one filter, and you have the UV, a very simple installation, and we installed this in schools. You see, the smallest we have can give you up to 500 liters per hour, and it comes with a lamp of 16 watts. It's very small. And the advantages you have is this: yes, no chemical addition, so the water test is not affected, and the operational cost is very low, as low power is required, and there is no possibilities of overdose. Another range that we have on UV is CT UV. This starts from the smallest 600 liters per hour up to 20,000 liters per hour, which is commercial and industrial. But our focus here, we will look more on what we do on the small scale, like the schools, hospitals, and small places like workplace where people need to get a safe, clean and safe water. This is another type of a product. We call it pure water. This is locally assembled. As you can see, everything is fabricated locally to suit the requirement. We can have this from 500 liters per hour up to 2,000 liters per hour, depending on the requirement of water. Now, looking on case studies, this is a recent one we did just some like a month ago. This is for a small is for a household where they decided to have clean water for all the use in the household. As you can see, there is a UV. You have a pump because this need to produce about 1,000 liters per hour, and you have the filters where we have 4 stages. You have the filters which are used to reduce the contamination of water, to remove the suspended solids, to make it easier for water to be effectively treated by the UV. And this one is for a factory, a cement factory in Mbeya. We installed this, there are 4 numbers, the factory with over 300 staff. These units, they are fitted in various places to make it easier for the worker for the staff to get access to clean and safe water. It comes with 2 UV lamp to enable it to produce 2,000 liters per hour. Very effective, and it's easy to maintain, of course, because of the high requirement of water. It comes with a pump to pressurize the water. And this is another factory, Trigger Cement. This is another type of product that we manufacture. You can see it comes with taps which allow people to get water easily. This saves about 300 staff in this factory. We have 3 units of this, which can produce 2,000 liters per hour. Yeah, this one is for one of our clients called it Patel Trading. Is also used for providing safe drinking water to staff as per the requirement. So this one can save up to 50 staff per day. As you can see, this the tap. You don't see a tap here because the installation is installed in a different place, and then the tap connected directly to where the staff can easily get the water. This one is for wildlife forage, which also we have installed about 2 pieces. One can do 2,000 liters and another one 5,000 liters per hour. They serve about 150 students on the area. And it's very simple. It comes with a filter, the pump, and also you have the UV on the top. Yeah, and that comes to an end of my presentation. Thank you very much.
Oh, perfect. Thanks. Thanks very much for that, John. As interesting to get a more of a vendor and manufacturing perspective. So from here, we're switching to our open discussion. So the idea now is to bring back all of the speakers, as well as you attending, to discuss some of the themes that have come up today and where we go from here. And leading that discussion, who just put on her camera, is Dr. Sarah Beck. Dr. Beck is a professor at the University of British Columbia, and she's passionate about applying ultraviolet light for ensuring sustainable management of water and sanitation, related to Sustainable Development Goal 6. She and her multinational research group are investigating novel applications for UV light emitting diodes for small-scale water disinfection and wastewater reuse in Southeast Asia, East Africa, and rural Canada. So Sarah, feel free to take it away, and I'd invite all of the speakers to join Sarah with their cameras and microphones on.
Wonderful. Thank you, Nathan. And thanks very much. Excellent talks, everyone. Thank you so much. It's inspiring to see all of your work in advancing safe access to water and sanitation for all. And it's great to get the many different perspectives from someone familiar with the UN and water and sanitation and the whole process. And then also to get vendor input, and then to get Dr. Fermín's input as well about water and UV access in rural communities. So I wanted to start first off by bringing Clarissa back into the discussion. And so given your experience advancing access to safe water, You mentioned that roadblocks are institutional and managerial. So given that perspective, and we learned about other obstacles as well, I wonder what your perspective is about the potential for UV now, especially after hearing the talks today about actual projects, about using it in rural communities in Mexico and in Tanzania.
Hi, thanks. I'll try to speak to that a bit sort of off the top of my head. So excuse me if it sounds a bit stream of consciousness. I think I found it very interesting listening to the other speakers, in particular, talking about the idea of a kind of service delivery approach. And I think this is happening across the water sector, that we're beginning to realize that we can't categorize water sort of delivery based on the technology. It has to be based on the service, because in the end, I think the user is pretty agnostic. The user just, the kinds of things the user wants. A user doesn't say, I want a hand pump or I want a UV system. The user says, I want generous amounts of clean water in my house, and I don't want to have to go and walk and fetch it, and I don't want to have to go without it on certain days. I want it to be reliable and always there. So the idea that you provide a service and then you come up with the best technology to do that is, this is a systems approach, and that you put the entire service chain in place, or you make sure that it's there, so that it's not just the technology, it's also the whole system whereby money is collected to pay for maintenance, and then that maintenance money is well managed so that the maintenance could be done when it's needed, and you upgrade and you rehabilitate as you go along. And that requires a much more complex system to back everything up. I think one of the things that I would just say, and I hope I'm not being too provocative here, is that quantity of water is as important as quality of water. And I'm sure everybody who has worked on this has seen that. So I think that UV systems, which concentrate on providing good quality water, still have to be backed up by something that will make sure that the quantity of water is there, and the water is in the place where you want it to be. And I'll just make an analogy here. When I worked at UNICEF, we often worked in humanitarian situations in which people had been displaced or whatever, a rapid onset disaster. And we would have many people coming to us to offer water treatment solutions, new types of filters, new types of chlorine tablets, etc. And in fact, the biggest problem was that people didn't have access to water sources. You needed the systems that would bring water across long distances to make up for the fact that whole pipe systems had broken down because of some sort of natural disaster. So I would just say, how do you then couple UV systems and this very sort of cool technology with both the systems approach that will make the whole institutional setup work, and also with actually making sure that the quantity of water is available?
Excellent point. Okay, yeah, excellent point. So you talk about a lot of times, as the point came up before, that household water treatment systems kind of transfer the burden to the household. That's one. And then the issue with quantity and quality. I wonder if the other speakers have a comment on that. Some of your systems are able to supply a heavy quantity.
I think that's one of the greatest advantages of UV disinfection. I mean, in terms of the capacity to treat water, it's huge. It's great. I mean, the household system that I was describing, and also to address some of the earlier questions that I was able to read, with a lamp, 15-watt lamp, we can produce 5 liters of water per minute. And if you can operate that in a continuous basis, you basically can supply a whole village. So, I think that, again, like not changing the taste of the water, having a broad disinfection spectrum in terms of bacteria, viruses, protozoa, and having this very efficient way and fast way of disinfecting water, I think it's what makes UV disinfection so attractive. And I completely agree with what Clarissa said in terms of users. They're quite agnostic in terms of technologies, but they do have certain things that they are very important for them. They don't want water that tasted bad. They don't want to wait a lot for water. And these demands that users have, in general, I don't want to say that UV is a silver bullet, but in general, UV is very well posed to meet those needs. Of course, you need electricity. UV, it's more technical than other treatment mechanisms. So you need a service delivery model that is more robust. But I think it's a great, and we are seeing also innovations with UV LEDs that finally are getting closer to, to be solutions in the market. And I think it's a quite exciting technology to meet the needs and demands of users.
Excellent point. So one of the things that Clarissa was bringing up is the perspective of, a disaster relief and humanitarian response and having the silver bullet technology and showing up. And then with a lot of the systems that were described today, you have the time, you have the luxury of time to actually create and develop a system and train communities and kind of build capacity. So I'm curious if some of these systems could be applied in that context with the disaster relief, or if there's additional complexity for UV systems versus something like chlorine, where you need more time for training people, operators.
So, I mean, I think in emergency situations, it's actually, I think it's a more mature sector than sustainable services. And there are plenty of technologies that work and have proven to work during emergencies. I believe that during emergencies, people are less worried about things like taste, which has been one of the challenges of chlorination. But I, having said that, our work with communities with UV disinfection at the community level started with an emergency in. There's a state called Tabasco in Mexico, which is basically where two of the largest rivers in Mexico meet. And in 2007, there was a very big flooding that affected the cities and all of the rural areas. And we were able to, in a very improvised way, but we were able to equip this household UV disinfection system to meet the needs of a community. And in general, it would take us half a day to train a group of people in the community and to install it, whether in a school, in a church, if there was a small government office in the community, and then people during the emergency, during the flooding, would come with these 20-liter containers, fill them pretty quickly, and then bring them to the home. So, and then from then we started working a lot with the UNDP, with the United Nations Development Program, with their risk management program, and they have a pretty good methodology in places that are where things like flooding happen in a regular basis. They work with the community to develop their mechanisms to prepare for disasters and also to respond during the disasters. And so we implemented about 20 of these very basic kiosks that for more than I would say the majority of these 20 systems work for more than 5 years, and some of them even up to 10 years. And every time there was a flood or they had problems where like the road was not leading to a community, well, the road was damaged, they were isolated from the community, they couldn't buy bottled water from outside the community, they would activate these systems and operate them during the emergency. And again, they were powered. So the main mechanism for disinfection was UV. And the challenge, again, was that people outside of the emergency, they did not use the kiosk model, and they would revert back to drinking contaminated water. And so I don't think that UV is a silver bullet, but I have seen it work, and we have seen it work in emergencies, and we have seen it work at the household level. I think one of the big challenges in Mexico is, and it tends to do a lot with regulations and where government is investing, we have not seen it at the community level, and that's kind of where we're moving in with Cántaro Azul as well. And but there are a lot of regulations that make it more difficult for UV to work at that level, because especially like water testing has been thought a lot for around chlorine, and so so that's one of the challenges, for example. But one of the areas where UV disinfection could have a lot of potential in small scale pipe systems.
Sarah, can I butt in here?
Please do. Yeah.
Sorry, and I'm very sorry. I didn't mean to bring up humanitarian situations in order to prompt a sort of feeling that you needed to defend or otherwise justify whether UV was suitable for humanitarian. The reason I mentioned it is that in many situations, and humanitarians are not just situations, are not the only one. You have to have water to treat before you think about what your water treatment mechanism is going to be. So I think the point I was trying to make is that UV can be a very promising treatment method, but it has to be coupled with some method to actually get water into people's homes in the first place. So it doesn't solve the problem of the water source. Where is the water coming from, and how is it actually being made accessible to people? The other thing that I'll mention about water treatment in humanitarian emergency settings is that the thing that seems to have the biggest influence on whether you can get people who have, for instance, been displaced or living in a refugee camp to treat the water is whether they were doing it at home before the emergency hit. Very difficult to try to get people rapidly up a learning curve of how to dose jerry cans with chlorine tablets or use UV or use filters if they haven't been used to doing it. It's not a good time after they've sort of had to run for their lives or whatever to say, oh, and here's a new skill you've got to learn. So I think that there's a huge benefit in getting people used to the idea that if their water isn't safe to drink when it enters their home, that they need to treat it, because it will stand them in good stead if they ever are in a situation where they have to then adopt an emergency treatment.
Absolutely. Well, that's a great point about the water source, and some of the attendees had a question about that. What is the water source for these systems, and how do you ensure that it meets the criteria where UV is effective? How do you make sure turbidity is low enough or that the UV can penetrate the water and inactivate the microbes?
John, do you want to talk about sources or?
Yes, yes, thank you. On water sources, we have various water sources, the surface water. Normally, surface water is highly contaminated with turbidity and silts. So it's another challenge to make sure that before the water go through the UV, they are free of turbidity and any contamination of silage to make it effective for UV to treat the water. And to be able to effectively use the UV in such a situation, we must have the filter, which will ensure that water is clear before entering the UV. When looking at the surface water, the turbidity varies from one source to another, and that is a question that we always need to have in our mind when approaching these different sources of water. There are in some situation the water are very turbid, and you might need even to employ more aggressive pretreatment to remove the turbidity, especially like during rains. The river water are very turbid. Sometimes you need to use special chemicals to reduce the amount of turbid before you pass them through the UV. and also apply like sand filters, which also will help to reduce the turbidity, and then use the smallest micron filters to reduce the silting. Yeah, that's what I can comment on sources of water.
Can I add to what John has said? So in our experience at the household level, I mean, UV makes sense when you have access to water that it's clear. And you have to make sure, once it's clear, you also have to make sure that there's no iron in it, because the iron absorbs a lot the UV, and that can really impact the effectiveness of the system. But if you have a source that, like a surface source that, you know, through a big period of the year is going to have turbid water, it might make more sense to use a ceramic filter or another mechanism that can reduce that turbidity. And one of the big advantages, for example, of ceramic filters is that people actually see a change on the water, and they prefer much better to have water that it's clear than have water that it's turbid. So, but once you move into a scale of a school or a community, most of the times UV disinfection is coupled with other treatment options that can tackle some of these other contaminants or challenges. The one that we have more trouble managing is color and sometimes the taste that it's created with stagnant water. And so to remove the kind of a strong taste on the water, it has been challenging, and it requires technologies that sometimes don't couple very well with UV disinfection. So with UV disinfection, again, you can have a very high flow rate. So if you want to cope, and it can be very fast to meet the needs to meet the daily needs. So if, for example, flocculating water, of course, can help you, but you will be putting together two types of technologies that, if they're not well designed, one might make the other one quite slow. But you can, again, more in general, most of the sources that people use at the household level or the school level where we work, it's rainwater harvesting during the rain period, and then they move back to wells or to springs, improvised springs during the rest of the year.
Excellent. So it sounds like there's definitely control over the water source that's coming into the system. Some questions have come up about the design, other design considerations. So some of our attendees are in the UV industry and are curious about things like, how do you control other parts of the UV system? How do you control, well, your flow rate for one? How do you measure for lamp output or lamp breakage? Are there any kinds of sensors? Just things like that.
So I'll take that first, and maybe John wants to add more. Sure. So in the household system, in the very basic one that we call the Mesita Azul, we the water flows by gravity, and because at the height where the bucket is put on top of the Mesita Azul, and also the way the UV chamber is designed, it just has a maximum flow rate of 5 liters per minute. Of course, as the water starts to go down in the level of the bucket, you have a lower flow rate, but in average, it's around 4 liters per minute. We have implemented UV systems in households that have pipe water, and we have to add an extra valve. And what we tend to do is to do the installation, and then if we have a peak of pressure, like for example, most of these towns in Mexico, they distribute water sporadically in an intermittent basis. So when there is pressure on the water, we start closing one of the valves, and then we fix that valve, and we spend about 5 to 10 minutes regulating the flow to reach a maximum of 5 liters per minute. The design that we use is not pressurized, so it has certain challenges. It's not that you can just open and close the valve and it will work as most of the commercially available systems. But it has other advantages, like being designed in a way that it doesn't require maintenance until the lamp breaks. So the critical element there is that the user needs to have feedback when the lamp stops working. And in the most basic design, there's a small window that doesn't let the UV light out, but it lets some blue glare come out. And it's in a visible place where people fill their water bottles or these 20-liter jugs. And so as long as the lamp is turning on, it's disinfecting the water. It's enough disinfection. And that the key thing there again was to be able to design the chamber in a way that it delivers a very high dose. And of course that reduces the flow rate to deliver that dose, but it's still a pretty big flow rate. So it's not a challenge or a problem for end users. We moved away from these systems that are installed at the household level. We moved away from adding extra sensors like an intensity sensor or a flow rate sensor, because those tend to break faster than the actual lamps. We have seen lamps working for 5 years. They tend to work for at least 3 years on a household level. But even 5 years, it's common to see lamps working for 5 years. Also at the school level, they also work that long. And so we tend to make the system. We try to make the system as simple as possible. Now, as I mentioned, now we're actually doing this parallel test where we're using a commercial system that has a controller, and the controller looks at the current going through the lamp, and if there is no current, it shuts down if it sees something strange, it shuts down the flow, and it gives the end user a certain message depending on what's happening. And so finally we have this hypothesis that the more basic the better, but finally towards the middle of this year, we're going to have the results and be able to have a more direct comparison at the household level what works best. When you move into and it kind of is similar at the school level, because again, like these systems are being operated mostly by students, kids with 11 years old. So again, the more basic, the better for us. But once you move into a kiosk level or a community level, I think it makes more sense to use the commercially available designs that incorporate a combination of detectors or meters that allow the system to perform within a certain range. For example, this challenge that we saw at the household level of developing scaling, that is not really a problem when you have a kiosk working with a UV disinfection system or a community system working with UV disinfection system, because there's a person that is paid or that earns money doing that job, and so you can put it as a regular activity that they have to carry out, cleaning the quartz leaf every so often. The problem with cleaning the quartz leaf is when you move the responsibility to someone inside the household or someone in the community, someone at the school level, where they're not really necessarily trained to do that, or where they're not really being paid to do a certain number of activities.
Excellent. John, did you have anything to add with the Davis and Shirtliff?
Yes, I agree with Fermín. On the small scale household, the design are very basics to be able to detect automatically. For example, in my presentation, what I showed as the smallest unit, that one, as per the recommendation from the manufacturers, that for continuous learning, you can you need to replace the lamp after learning it for 9,000 hours, which is approximately to 1 year of continuous learning. Of course, normally in a normal setup, it is not continuous, so it can do more than 1 year. And now the question is when to count the hours, because these units they don't come with like they don't come with a gadget which can count the hours of working. That's an issue. So what we always advise our customers is to just work on the number of years, 1 year, which is quite not reasonable to replace the lamp. The lamps, of course, are not very expensive, very cheaper. For more advanced options, we have ones which comes with controllers and sensors, which they can actually detect and give you a signal when things are not in order. So it's all on how you manage. But the most important thing is to give enough awareness to the user, knowledge. That is where now a gap, and that is where we try to come in and try to assist more the users to understand how to take care of it. Yes, thank you.
Sure, thank you. And to follow up on that, with the knowledge transfer, how long does it typically take Davis and Shirtliff to train a community to operate those systems?
Yeah, yes. When we, during at the beginning, we give a lot of information to the user, including the manuals, because these items, of course, very few users read the manuals. So we, in communities where the use is huge, we are organizing something like a service plan. We work together with the client on a planned schedule to check and see if there is any issue. And most of our customers around here, especially the schools, we are doing arrangements where maybe in a year we have our guys moving around after 6 months or so. That helps to see and check if everything is still working okay. Yeah.
And with those systems, there was a question about the affordability of them. At some of the schools that you're talking about, can these be applied in marginalized communities, like say slums, for example, where it's difficult for people to have enough money to eat? Are they able to collectively purchase a system like this for water treatment?
Yeah, good question. Over the years, the company has really tried to work on pricing because that's a big issue, affordability. And we live in a community where people do not have enough resources. They cannot afford to buy these systems. But now we have systems which are very cheap. They are affordable. The basic one is the one the one I was talking about for household. It goes below $100, which is many people can afford now on UV. And for the schools, as I showed on my presentation, we customize. We come out with different design, simplified setup, which are very cheaper to allow them to afford. And then the maintenance cost, because you have the filters that you need to replace on regular basis. Also, we also have very cheap filters that they can, that also are easily affordable. So the question of affordability, yes, is there, and we have really tried as a company to work on that area. And now I can say the prices are coming down regularly. So yeah, that's something we can advocate for that. Thank you.
Yeah, and speaking of affordability, a few people have mentioned LEDs, and obviously those are a little bit more expensive than mercury lamps or the lamps that are being used in both of your systems. What do you think about the potential for LEDs? You brushed on it a little bit earlier, but do you think it's close that those can be used practically in widespread applications, or do you think we're still a little bit off?
On the LED, that is something I will not talk about because we have not really looked at it as a company in our market. That is something maybe can be looked on later, but for now, we just stick with the UV. It's the best one, yeah.
So I wanted to touch on something also that Clarissa mentioned, where in certain regions, the work done by nonprofits kind of develops a parallel, develops a parallel path that in which governments do not really assume the responsibility on ensuring the human right to water. And for example, here in Mexico, the human right to water and sanitation was recognized on our constitution in 2011, so 10 years ago. And it's the responsibility of the municipal, state, and federal government to ensure that the human right to water is assured to everyone. But it's it hasn't really. There's a lot of resistance from the governments to assume that responsibility, and we also, as a nonprofit, we started first with very little capacity to change policies or to change the water sector in Mexico, and that also reflects on why our work started on designing a disinfection system for a household level. That's kind of the area where we could make a difference. But as our organization has been growing and having more relevance in the water sector in Mexico, and also as we have learned more, we have come to believe that kind of the most important contributions of our work are to develop models that can be taken up by the government and brought to scale. We have tried to, in a couple of scenarios, we have tried to go through the route of developing models that work with kind of a business principle, but that tries to develop kind of an equitable and fair service for the community. And we see a lot of limitations. Again, when we try to do this work in marginalized communities, developing a business model that serves everyone in the community, we don't see the conditions happening now. Of course, there could be changes in policy, the markets could mature, income could increase in certain communities, but we see that for most marginalized communities, really, a solution that helps families and helps communities achieve the human right to water, it's unlikely to come from the private sector. So one of the things that we have done, Latin America unfortunately has very little innovation happening in water and sanitation compared to Sub-Saharan Africa and Southeast Asia, and in part I think has to do with the limited participation of the international community in Latin America. The international community tends to assume that we're doing better when they look at our GDPs and when they look at our governments, but we are very unequal countries, and rural communities and marginalized communities have similar challenges than in other areas, and I think so. This is a call, to bring kind of more attention to the region. But one of the things that has been developed in Latin America is these community-based associations, and it hasn't happened in Mexico so far. But and kind of we're working on that, on stimulating that. But in many countries in Latin America, communities, this association or committees that develop at the community level, they develop partnerships with other communities and create associations that represent them at the municipal level, at the state level, at the federal level. And that's very important because, or it has been very important for these communities to do that, because it has allowed them to exchange best practices. And if you don't do that, it's kind of every community has to reinvent the wheel, and it's very difficult to reinvent the wheel of water and sanitation services. of sustainable water and sanitation services that reach everyone in the community. So so these associations, in addition to being places that where they exchange knowledge and best practices, they also bring in enough key communities that develop enough power to communicate with the government in a more equitable basis. And so we try to learn a lot from what was happening in other countries. And in Chiapas, we have been able to, with many other partners, not only Cántaro Azul, but we have been able to develop two models that are really interesting. One is with a municipality. We saw a new mayor that really wanted to make a difference on water in rural areas. And we were able to create the first public community partnership in Mexico, in which the municipality created a water board for rural communities. And in that water board, half of the directors are more than half plus one of the directors are appointed by the rural communities themselves, and half minus one of the directors are appointed by the municipal government. And so it's creating this governance structure where, like, finally, where the municipality has an entity that raises awareness and has the capacity to make decisions and to invest in rural communities and in water services in rural communities. And so we are trying to, UV disinfection has been used as some of the technologies that are implemented by this water board, but we're trying to now replicate that in other municipalities in Chiapas, have that model recognized in the state law, and also try to influence what public policies that happen at the national level. And in contrast to that, in another region where the municipal government doesn't really pay attention to the rural communities, we also collaborated with communities to help them form an association that represents now 35 communities. And it has allowed them to interact with the federal government and state government and really bring attention to the issues that are happening in their communities and to redirect investment in a way that makes sense. Mexico, for many years, the water sector for many years in Mexico has been really dominated by big investments and also by local construction companies. And these investments tend to favor politicians and also the construction companies, but they end up putting all of this infrastructure that is not really providing a service in terms of quantity or quality. And so we really need to make this shift on public policies across Latin America, particularly our work in Mexico. And we believe that these community-based organizations, particularly when they're able to create associations that represent them, it's kind of the way forward. And at the beginning, definitely the nonprofit organizations have a very important role in helping that happen. But later on, the idea is that the government can take on that model.
Excellent point. And I'm glad you brought this up. So you brought up the two last areas that I wanted to talk about. And one was models, either funding or operational models for ensuring successful water access. And then the other was regional differences. So we have the opportunity to have three people from three different places. And so you mentioned Latin America. And when we saw the joint monitoring program data earlier, we see Latin America has, I think, 82% access to safe water versus East Africa or Sub-Saharan Africa, which has 13% access, and then versus Canada, which is closer to 99% access. So I wondered if the other speakers wanted to weigh in on, I guess, regional differences or funding models, so following up on what Fermín was just talking about.
I would like the other speakers to go first, but I want to come back to this one.
So I'll come in just with a few sort of random observations. I don't know if I'm going to answer your question or not, sir.
Sure.
Mentioning the human right to water, I think, you talked about a big frustration, which is that a government recognizes the human right to water, but then actually doesn't do very much to turn that into a reality. And I think part of the problem is sometimes governments feel that operationalizing the human right to water is going to mean that they're somehow going to be on the hook to give people free water or to always be the service provider. And that's not what it's about, right? There's nothing in the interpretation of the human right to water that says that water has to be free, or that it has to be actually provided by the government. It's the government's job to find service delivery models that make sure that people have affordable water. It does the SDGs do speak very specifically about water being affordable. So governments should really be interested in looking at a range of delivery models, using the private sector where the private sector makes sense, but with strict regulation and contractual obligations. And then using things like, community groups where that makes sense, but with lots of support, because I think what we've seen in many places, and particularly in sub-Saharan Africa, is that community management can often be extremely weak. And basically all it does is push the burden of management onto very poorly resourced, very small communities. It doesn't make any sense. So, government has to sort of think a bit outside the box and be willing to think about all these different kinds of models, and the policy direction that you'd have to take in order to make them possible, and then the ongoing obligation to support them. So, things like associations, I think can work very well. I'm always worried if you end up with a model that relies on international assistance. Let's face it, that's not a long-term strategy, because all of us working on international development should ultimately be looking to work ourselves out of a job. We've seen international development assistance shrink very much in general over the years. It's not going to expand. I think those days are gone. So really, governments should be looking for models that use the available international development funds extremely strategically for things like capacity building, but are not reliant on those funds being there in perpetuity. Can I also just say that, speaking from a Canadian perspective, and I think many people on this call are Canadian, we should never rest upon the laurels of that 99% number, because we all know that hides some huge inequalities, and that there are many communities, mostly Indigenous communities, that still have pretty poor water and sanitation, and that wealthy countries like Canada should be drilling down into those final few percent of unserved. And that's really what we should be reporting on. We shouldn't be reporting the 99%. We should be reporting on what's happening with the 1%. And I think it's actually probably higher than 1%. So I think there is some pressure on the JMP. Certainly the work that I'm doing with the JMP, it's something that I keep raising, is that the JMP should be casting a particular, the microscope should be trained in a different way on wealthy countries to really challenge them to explain what's happening with those remaining few percent.
Sarah, may I?
Absolutely.
So in terms of the numbers in Latin America, those numbers were not necessarily access to safe water. They were access to water on the premises. And yes, in that case, for example, Mexico is not doing that bad. The Water National Commission reports 95% access to water on the premises. Their data doesn't take into consideration infrastructure that has been abandoned, and so it probably goes down to like 80%. But when you start looking at water quality, then it happens like one of the slides that Clarissa showed, where Nepal went from like access to water on the premises around 80%, if I recall correctly, or 70 something, to like 17%. That's basically what happens in Mexico, both in urban areas and in rural communities. And the difference is bigger in rural communities. We did the first nationwide study on water quality on pipe water systems that were implemented by the federal government in 300 communities. It was a random sample of 300 communities across the country out of 20,000 systems that were implemented by the government. And 40% of them were delivering water with E. coli, less than 20% were disinfecting water, more than 40% had either arsenic, fluoride, or nitrates and other contaminants. And we had a limited number of parameters that we could measure. So once you move into sustainable development goals, human right to water, or you have a health perspective, then again, Latin America seems, has this image that it looks like we're doing better, but that's only in terms of infrastructure that has been implemented, but not on how that infrastructure is working or delivering safe water or not. I fully agree that Latin America particularly should not depend on international development or international aid. My case is that the international community has not paid enough attention to places like Latin America, and I think there are ways to invest in Latin America that are very efficient, like developing models and working on public policy, but not really funding infrastructure. That shouldn't happen in Latin America, at least in Mexico, it shouldn't happen. The Mexican government has enough funding to solve or to at least make significant progress on water challenges. It's just that it doesn't prioritize it, and it doesn't have mechanisms to do it effectively. And in terms of putting all the burden on households or putting all the burden on communities, we have seen it directly. It's way too much burden, and you just, even if it works for some people, just continue with the inequality gap, and that's one of the things that it hurts us more in Mexico and Latin America, like the inequality that we have. But to be able to recognize community organizations and to create governance spaces with this idea of public community partnerships, then the responsibilities can be distributed adequately to the capacities of each of the participants, and that's what we think in Mexico can make sense, and not in all Mexico. Mexico is a very heterogeneous country, and that's one of the challenges that also in the water sector, that sometimes you can have one community with certain characteristics of water and certain characteristics of organization where a service model will work, and then a nearby community where that won't work. So I think that's one of it makes the sector very complex, and we need to assume that complexity and be able to develop policies, investment mechanisms, and technologies that can work under that complex scenario. And finally, in terms of the private sector, one last thing that I want to share is with the kiosk model, what we were able to achieve after several years of working on the kiosk, on this franchise model. It's like the technology was really easy for people in the community. In this case, it was women and local entrepreneurs. It was really easy for them to learn the technology and to make, and to be able to operate a system that purifies the water and puts it in a 20-liter jug. Really, the challenge was how to make it sustainable and how to reach almost everyone in the community. And we, in this model that was operated by women entrepreneurs, we saw them. The main challenge that we saw is that there wasn't a change in responsibilities at the household between men and women. And so women, they were leading this water kiosk in their community. There were amazing things like, them riding a motorcycle and bringing water to the homes. And that was a kind of a game changer. Like, the community would say, like, we didn't know women could do that, And so it was really, we didn't know that women could run a business. But the problem is that they had to go back to their home and take care of children and take care of many responsibilities in the families. And it was really difficult for them. And so it ended up requiring many women partners to run a franchise model. And so the benefits are really small, because you have to distribute the earnings across everyone. And then, so it's kind of not worthwhile the challenge, or they would just kind of stay on the break-even point. And, and for them, they would just, negotiating all the complexities of their daily life. They stayed in the break-even point, rather than kind of pushing a little bit more ahead and being able to be in a much better business situation, and that on one hand would deliver water to more people, and on the other hand would make their business more sustainable and also more easy to replicate with finance, for example. And so we think, I mean, there are many experiences and communities that are working on water, safe water, like with water enterprises, with these kiosk models, and there's a lot to learn from them. The majority use UV disinfection, and because it's really a great technology in many aspects. But also the majority, from the business perspective, they have certain type of subsidies, whether it's donations from outside, whether they provide like free water to the school, but it's being funded from somewhere else. Just like a plain business perspective for serving marginalized communities, we have not really seen it. We have not really seen it, especially one that can make almost everyone in the community gain access to safe water.
Absolutely. So I think we'll start to wrap up, but excellent points that there are different models, there are different approaches, and there are different considerations when trying to realize Sustainable Development Goal 6 and achieving safe water and sanitation. We haven't touched too much on sanitation in this webinar, but hopefully in the future. But obviously, yes, it's a very complex problem, and we touched on that, and we touched on the fact that we need technical solutions and also non-technical solutions to achieving safe water access. And also that UV is absolutely one potential solution. It's effective, you can get high flow rates, it can be affordable, it can be long lasting, and it can be appropriate with adequate support from education models, from municipalities, from NGOs, and from government, and especially policy. So with that, I think we'll go ahead and close out, and I'll hand it over to the webinar organizers to close out. Thank you all very, very much. Thanks to our speakers and of course to the attendees.
And thank you, Sarah, for moderating that discussion. That was great. And like you said, with that, we'll close this webinar. Again, I want to echo what Sarah just said and thank everybody who has attended for joining us, and also thank the speakers for dedicating your time today. Before you all go, I just want to quickly note that we will be sending out a questionnaire by email just to get your feedback on today's event. And that'll be pretty helpful for all of us in planning future events and future initiatives for this task force. So if you have 2 minutes, please fill that out. Again, that'll go out as a post-webinar questionnaire. Also, if we were not able to get to your questions, we will do our best to answer them after the event and distribute those answers along with the webinar recording. And one last thing, this is not the end for this task force. You know, we're aiming to have more of these discussions and maybe publish more, publish information from these discussions in things like the IUVA's magazine or other places. So please keep an eye out for more news from this group and more events, because like I said, this is definitely not the end. And if you'd like to get involved, please feel free to reach out to any of us. Hadass shared an email at the start of the webinar, and I know the speakers have shared their emails as well. So if you'd like to get involved or get in contact with any of us, please feel free to reach out. And that's all I have to say. So again, thank you all for joining, and I hope you all have a wonderful rest of your day.